Hello, my name is Dr. James Thompson. I am a board certified allergist and immunologist practicing in the Chicago and Greater Chicago area. I am also a board member of Healthy Living with a Vision, a 501c3 foundation that has a mission to address healthcare disparities as it relates to Black and Brown people in Chicago and in the Greater Chicago area and region. Did you know that September is Prostate Cancer Awareness Month? And did you know that African American males have a approximately two times greater risk of developing prostate cancer compared to whites? And additionally, African American males have a greater than two times chance of dying from prostate cancer once it's diagnosed. Well, that's the reason we need to be our own advocates and make sure we're up to date on screening exams depending on our age and other factors like family history. Now, if there's a family history of prostate cancer, screening should be significantly earlier than recommended. Now, there's the rub. In 2012, there was a policy that it was adopted in this country to not be as aggressive with screening exams for prostate. And there are two screening exams. There's the digital rectal exam, DRE, and the PSA, the prostate specific antigen test, which is a blood test. Now, these procedures have been around for years, but a large study in Europe and some studies in the US really exposed the fact that screenings may not have a good risk benefit ratio in terms of what you can gain from them. That some people have more benign cancers that end up leading to them having more procedures of diagnosis, only to find out that they don't have an aggressive disease or a disease that needs treatment. Now, the problem with this study, folks, is that it was primarily in white men. The European study didn't even give the demographics, but they were predominantly white people. And in the US, it was less than 7% Black in terms of people that were in the study. So the current guidelines fail to address the increased risk of death, the increased risk of having the diagnosis in Black males. Now, women, stay tuned here because I want you to listen to all of this also because you have such a great influence on males. And I only mean that in the positive sense. Men, we need to get our act together because we need to get these screening exams done. We should start thinking about it once we get past 40. Earlier, perhaps, if we have members in our family that have had prostate cancer at an earlier age, like under 50, or even in the 50s. It needs to be a discussion we have with our doctors because in 2012, they said that the policy was discuss with your doctor. It wasn't going to be an automatic age to have screening tests. Now, they amended it in 2018 and said, well, at a certain age, you should have that if you're a male. You should have that discussion about whether to have the pros and cons of the screening for prostate cancer with your doctor. But that still doesn't serve Black males well because, let's face it, most of us don't want to have that discussion. And many of us don't want to have that digital rectal exam, the DRE. Now, DRE, that spells Dr. Dre, so it's got to be golden, right? Sorry, I couldn't help myself. But the digital rectal exam is important. It might pick up signs of a cancer that the PSA may miss. The PSA, the prostate specific antigen blood test, is not 100%, nor is the digital rectal exam. So they can complement each other in helping to determine whether you might have prostate cancer. And since it's more aggressive in Black males, we need to be more aggressive about making sure we are screened. Now, some studies have shown that lifestyle and diet changes really can make a difference. Not so much in the prevalence or the likelihood of being diagnosed. I was sorry that with thousands of patients being in a study, they didn't find that. But what they did find out is that people that have the diagnosis of prostate cancer, if they have a healthy diet, they eat more plant-based, they get proper rest, they have a balanced nutrition, that they have greater outcomes. There's a greater chance of longer survival. And that's what, with treatment. So what that tells me is we have another situation. We need to use every tool in our toolbox. We need the screenings. And yes, you might have to ask your doctor to do the exam. I know I feel uncomfortable sometimes when I think, okay, is it, time for the you know what? But we can do this, fellas. Women have to go through so much more at an early age, a lot more often than we do when you look over the course of a lifetime, with that speculum exam. We don't have to go through that. So we can do this. And it's important because too often the diagnosis is made when the disease is advanced. You see, there's a study I reviewed that showed that overall, if you take all ethnic groups in this country and look at the diagnosis of prostate cancer, most people have a pretty good, like greater than 90% 5-year survival rate. But if you hone down on those that have early identification, it's where the cancer is found early through screening, they have a 99% 5-year survival rate. And those that have advanced disease when it's first diagnosed, meaning they have distant spread of the cancer, they have barely 30% 5-year survival rate. So that's our motivation. It's the second most common cancer of men, so it's pretty common. Now, yes, sometimes it's a very slow-growing, non-progressive tumor, but studies can determine that. And there should be a discussion with your doctor about the risk benefits, and if the diagnosis is made, what are the risk benefits of various types of procedures? There's several of them. All right, I think this has run long enough. I just wanted to get that information out to you. Again, I am a board member of Healthy Living with a Vision. We do accept donations. It really helps. I'm not getting paid for this, and neither are other board members and participants. But we have a passion to really get information out. We have town halls, and we go over to churches as a panel of doctors. If you have a church you think you could use our services, let us know. Go to our webpage, Healthy Living with a Vision. We also have a Facebook page. So donate if you can. We'll accept anything. And I'd hope to see you at one of our productions, one of our town halls. We have one coming up on October 9th that will address monkeypox and COVID-19 and the latest vaccination information. All right. Thank you. Have a great week. Bye.